We are super excited to welcome Dr. Radhika Sekhri today for today's webinar. Thank you so much for taking the time to speak with us today. Dr. Radhika Sekhri is a physician specializing in gastrointestinal, hepatic, and pancreatobiliary pathology. She is currently completing a GI pathology fellowship at the Cleveland Clinic. Dr. Sekhri is board certified in anatomic pathology and completed her surgical pathology fellowship at Vanderbilt University Medical Center in 2023. She received her medical training and completed a residency at Albert Einstein College of Medicine. Her professional interests include high complexity GI pathology and mentoring future pathologists. Outside of her professional work, Dr. Sekhri enjoys reading, listening to podcasts, and experimenting with new recipes. In her free time, she loves creating fun, healthy meals for her kids, especially finding creative ways to make nutritious foods more appealing and exciting. Thank you for joining us today. We're so excited to hear from you. Is there anything else you'd like to add to your introduction and share about yourself before we get started?
Thank you so much, first of all, for having me. Again, as I was saying, this is a great initiative, and hopefully, this is very helpful for the med students. No, that was a great summary. I think you put it all together very well. Thank you.
Yeah, of course. To start us off, could you give us a basic breakdown of what the GI specialty involves, what pathology is, and how these two fields come together in GI pathology?
Of course. So, GI or gastroenterology is basically, it's a specialty of the organs of digestive system. So, the stomach, esophagus, the small intestine, large intestine, and it also includes liver, gallbladder, and pancreas. If you have any GI symptoms or complaints, you will go to an gastroenterologist, and based on what it looks like, he may scope you, he may do a biopsy, and then that biopsy comes to the pathology side, and that's what we look at, a liver biopsy, a biopsy from anywhere from the esophagus, stomach, or intestines. So that is a very like generic way of how this works.
Yeah, that's really interesting. I haven't really heard too much about the pathology aspect of GI. What initially drew you to this field, and was there like a particular experience moment that solidified your interest?
Yeah. So why don't I start with, what is pathology? Because honestly, a lot of people do not know about it. And it is such a big backbone of of our medicine and of our everyday, testing and how things work. So basically, there are two fields. There is anatomic pathology and there is clinical pathology. In anatomic pathology, you have histopathology. Histopathology will have any tissue study of any tissues or biopsies, resections. Like if a person has a biopsy, that will go to pathology and will be read by the specialist of that field, or maybe a general pathologist. And then suppose you have a surgery and you have your prostate out or liver out, or you have any kind of resection, any organ is taken out of the body, that is sent to pathology, which is grossly examined. Then we submit sections, and those sections are converted into tissue slides. We look at them and render a diagnosis. So that is all histopathology. Then another thing that comes under anatomic pathology is cytopathology, which is the study of fluids. So, any fluid of your body. Um, it may be urine, it may be pleural fluid, pericardiac fluid, any fluid that will go to the cytology. This also includes, like, if you have any, any neck lump or any lymph nodes, so they can do an FNAC, that is a fine needle aspiration cytology. And then that is also coming under pathology. And then the third thing is forensics, which is autopsy, which is examination of the post-mortem, or when we do not know the cause. And in that also there is a forensic, which is like, if any person has a suspicious death, that goes to the medical examiner's office, and they do the autopsy. And that is when you specialize in forensic pathology. And one is when you just want to know medically, like if a person wants to know that why their relative passed away, or what was the reason, so they will get an autopsy done. So that all comes in anatomic pathology. And then there is a clinical side. Clinical pathology incorporates like your everyday labs, like your peripheral blood smear, liver function tests, cholesterol tests, lipid profile, all that. And then, there is hematology, which will include a detail. Like suppose if you see something and your labs don't look right, you may have a peripheral smear, you may have a coagulation study, all that comes under hematology. Then any infectious workup will include microbiology, and then finally transfusion medicine. Like, if you have to have a blood transfusion, then you will go to a transfusion specialist and they will see what you need. So this is a basic overview of pathology. And how I came across is I was actually on my clinical rotation. So, we were doing rounds, and whenever we used to stop at a patient, I noticed that besides the history, the doctor would always say that, okay, did this patient's labs come back? Did this patient's biopsy results come back? And then they would always say, like, oh, we cannot go further unless we have the labs or the results back. So I was like, like they cannot make this decision without those results, which makes it really important. And that by that time, I had not rotated in pathology. And then similar thing happened when I was on my surgery rotation, and I was in the OR, and the surgeon was waiting for a frozen section, which is a big part of pathology, that the patient is on the OR table. And for example, suppose they do a maxillectomy or they take out part of your tongue, they will send it to pathology and say that we want certain margins examined. Margin is something that if this is the organ and they have cut it like this, they want to make sure that there is no tumor at the margin. And so, which means that if it is at the margin, it is probably left behind in the patient's body. And they want to make sure that all of the tumor is taken out. So they will send it for a frozen. And this is like an emergency of the pathology. So, there is a time, like we have to report the frozen. So it comes, we cut it quickly, we do the stains, which is the fast staining. We see it under the scope and we tell the surgeon what we see. It's a margin positive, and this could be like for lymph nodes and everything. So I was in the OR and there was the surgeon and everybody, and they were constantly waiting. And it was a difficult frozen. So they were calling the path, and basically they could not proceed with the surgery without the frozen section results. And again, I was like, see, like this is so important. And then when I finally came into pathology and, I rotated, I saw how it worked, then I really started liking, and I felt that everything elsewhere depends on pathology in some way or the other. So that made me really interested in pathology. That's how I got interested.
That's a great story. Kind of to go off that, so what made you interested specifically within gastrointestinal pathology, especially when you've described that there's so many different avenues of pathology to pursue?
Yeah. So I have done, like, basically I have done a pathology training in India. So that was a combined anatomic and clinical pathology training. And when I was coming here, so in my mind, I was like, I'm not a clinical pathology person. So I really like looking at slides, making a diagnosis. So I was pretty sure that I just want to go into anatomic pathology. But people do both, like, and then you can diversify. Some people practice both. So I just did anatomic pathology. And why I like gastrointestinal pathology is because now, especially with, so much of this junk foods and unhealthy eating, and we all are guilty of it, I think it is very relevant in today's era. And I also feel like, I have seen, like when I was rotating, I saw so many people who had just normal BMIs and they would come in and were diagnosed with fatty liver disease, which made me like it's very diverse. Like, there are so many organ systems involved. Stomach, esophagus, every organ has a different morphology of how it looks like. And there is so much diversity, you can never get bored. And there is, like, inflammatory disorders, autoimmune disorders, of course, tumors. So that made me really interested in this specialty specifically.
Yeah, that's amazing. Could you walk us through our journey, or sorry, your journey in medicine from your from medical school in India through residency and now through your fellowship?
Yeah, sure. So I did my medical school in India at Kasturba Medical College, Manipal, that is in the state of Karnataka. After that, I got into pathology residency in India. It was at Rajiv Gandhi Cancer Institute in New Delhi, which is basically like a cancer center. So I saw a lot and lot of cancer, like of every organ, basically. It was a very high intensity center. So I got a very good exposure. And, I just like, I fell in pathology before, and then like it just made become became my passion. Then I worked for 1 or 2 years, and then like me and my husband, we decided to come here. So here I started out as a research associate. I got a research opportunity in the University of Tennessee Health Science Center in Memphis, Tennessee, where I did a couple of jobs. I got very involved in digital pathology, and I worked. So I did a lot of digital analysis, worked with a lot of PhDs, and analyzed images, did all that sort of things. And then I matched into Montefiore Hospital, which is associated with Albert Einstein College of Medicine, where I did anatomic pathology. And then I went to do a surgical pathology, which basically is a more refined form of your residency. So in residency, you are rotating in a lot of other, you're doing a lot of other things and exploring more. This is just concentrated that you are going through different specialties, and you are, you know, uh, looking at more bread and butter cases, more intense cases. So I did that at Vanderbilt University, Nashville, Tennessee. And then I did a gastrointestinal, hepatic, and pancreatobiliary pathology at Cleveland Clinic. And now I will be joining as a GI attending at Henry Ford Hospital in Detroit, Michigan.
That's super exciting. What what did you enjoy most about being a research associate? You mentioned that like that was one of your first jobs when you came from it.
Yes. So I think I really liked what I liked most, because I was doing a lot of things. And I mean, if I go into that, it will take a lot of time, but I don't think that's important. But the most what I enjoyed was analyzing the digital, images. And we had to do the data analysis for a lot of PhD researchers. And, there were mouse studies. There was just so many things, and I really liked, because you create models, and then you let that model work and do the scanning, do the analysis for you. So that was the super fun part. And I think now that's so relevant with all the AI and everything. Like AI is getting in everything. So yeah, I think it's very good. And it's predicted that in the next 10 years, or maybe 10 to 15 years, we will go like completely digital pathology. Like right now, we are looking at a lot of places have gone completely digital. A lot of places are hybrid, so you can look at glass slides, or you can even like just look at digital. So that makes it more fun, because you can be in any part of the world, and you can work for some time, basically work from home and work at your own pace. So that makes it all the more fun.
Yeah, that's super interesting. I know a lot of us, or a few of us, are also involved in research within undergrad, and yeah, that's probably one of the greatest aspects of it. Just analyzing and just learning, I think, is the biggest appeal to research. But what does a typical day look like for you as a fellow at the Cleveland Clinic?
So basically, there are three fellows, and what we do is Cleveland Clinic is basically the highest, it's the place where you get the highest amount of consults. So basically, the fellow's major duties is to do the consults. So one of us is on the whole week, you are on gastrointestinal consults. So anything, so they may come from Hawaii, from China, from all over the world basically. And then one week we are on liver consults. So again, basically all the liver, pancreas, biliary tract pathology question cases were that on one week. And then the third week we were on the in-house bread and butter, more bread and butter cases. So that's how the fellowship was structured. And besides this, we had to do a lot of tumor board presentations, a lot of teaching conferences. Yeah.
Was there any flexibility depending on patient load or lab demands?
So basically consults are like, to explain more about this fellowship, consults are those cases which are looked by the outside pathologists, but they have a specific question about a case, or basically they cannot make a diagnosis. So those are really difficult cases. So basically, a pathologist has looked at it and he says that I cannot figure out what this is. Now you figure it out for me. So you get these big bulk of like 20, 25 cases every single day. So I would say that there is not much flexibility. The only flexibility is in the in-house week. Otherwise, like, you are always on your toes. You have to finish these cases. You have to order IHCs. IHCs is basically immunohistochemistry, which are certain stains that we do on the pathology slides. And basically, they are done more on tumor cases. And then, yeah, it's a very busy and, intensive fellowship, I would say. So you don't get much time, but you learn a lot.
So, what are some of the most complex or interesting cases you've encountered in GI pathology?
Um, Okay, so I would tell you one, like a very simple case and then a more complex case. So a simple case was that we had a patient who was, diagnosed with diarrhea, and it was persistent. And then he was getting these biopsies, and then there was no result. Why is he having this diarrhea? So finally, the result was that there was giardia in his duodenum, which was being missed continuously because it was very little. So, giardia basically, under the scope, and you can Google this, it looks like these small, tiny leaf like organisms which you will see between the duodenal villi, and they are very easily missed. And that was the cause of his diarrhea. So, that was an interesting case because, for if you see on the patient aspect, he was not getting an answer, and he was coming again and again to the clinic. There was like nobody could figure out what it is, and it was such a simple uh you know case. And then I think there was one more, again it was not very complex, but again very interesting in a way that this we had this patient who was having basically symptoms of different organs. Like he was having cardiovascular issues, he was having GI issues, and then he had no significant history, never had any cancer or anything. And then they when nothing made sense, none of his labs showed anything, then they imaged him, and they found that in the liver they sort of the imaging was vague, in the sense it was not sure if there was a mass, but it looked like something. And then they biopsied it, and it turned out to be amyloidosis. So it was his amyloidosis that was affecting his multiple organs. And then, then basically in these cases, you try to ascertain what is the primary cause, and then you treat the underlying cause. And if it is senile or age related, you just treat the symptoms. So you can not do anything, but at least he got an answer. So sometimes we get a lot of cases here which are requested by the patient himself. Like a patient went to an outside facility and he's not sure if the diagnosis is right. So he himself orders his slides to be sent to the Cleveland Clinic, and then he gets a diagnosis. So that's very interesting. And that's a cool thing that the patients can do themselves now.
So, with you saying that it's very patient driven, as a GI pathology fellow, do you get a lot of patient interaction? Because I know a lot of individuals going into medicine care about that aspect a lot. So, what would you say about that?
Actually, no, we do not have patient interaction unless and until you specifically go into a field, like, for example, transfusion medicine will have patient interaction. If you go into cytopathology, if you go do a procedure, like you go do a fine needle aspiration cytology, you will meet the patients, but you don't have patient interaction. Uh, I would say, actually, like for me as a person, I like being in my space and not talking much to people. So that is a very big pro for me. And I know a lot of people who prefer it that way. And I know, of course, there are a lot of people who go in for the patient interaction. But yes, if you are going into pathology and not into transfusion side, you will be on your own. So we have to be prepared for that.
So, as you said, the GI affects a lot of different organs and organ systems within the body. So, why is gut health so important, and how does it exactly affect these different systems within the body?
Yeah. So I think now, we are all aware the importance of gut health with, again, all the, the fad diets, the unhealthy eating. I think you can name it, and it is present in today's scenario. So gut health is basically very important because, as you said, it affects every part of the body. A lot of people may not know, but, like our brain, it has a lot of neurons or nerve cells, as you would say. The gut, actually, if you take the whole of it, it has 5 times more neurons than the brain. So it is also called the second brain. And it affects everything. Like if you can relate anything to bad gut health. Like, it will affect your skin. It will affect your brain activity. It will also affect, like if you can see, like in normal days, if you think that your stomach hasn't cleared that well, you cannot think right. You cannot think straight because it's bothering you. And it also affects, like, now we say that hypothyroidism is all in a way related to bad gut health. So, as I said, it's a second brain of our body, so it affects in every other organ, as you can think of.
Yeah, I know. Personally I've been trying to stop eating super late, trying to eat on time and everything, just because the days that I eat super late, I wake up feeling kind of groggy and tired. So yeah, that's why I've been
Yeah.
trying to read a little bit more into gut health because I'm trying to improve my energy each day. So yeah, that's really
Yeah.
interesting. What aspects of your specialty do you find most challenging, especially ones that students might not anticipate?
Hmm. So I think um, some parts, like people that don't know, is that one thing is that, some, like, I don't know, I think there is very vague information about pathology in general. One thing I've noticed, people either don't know, or then, they think that, yeah, it's a very easy branch. You just come in and go, and, you don't have to do much. So I think that's a one thing is a big misconception. You have to know a lot. You have to read a lot in this field. Irrespective of, like, in clinical branches, you see patients and you learn. In this also, we see cases and we learn, but I think a lot of it is that you have to read a lot. Even if I'm a gastrointestinal and liver specialist in pathology, I still have to know how a kidney carcinoma looks like. Because if a patient comes with a metastatic renal cell carcinoma and I don't know what that looks like, then I will not be able to go down that route to make a correct diagnosis. So, you need to know about almost every organ system. And then the other challenging aspect is frozen section, because it is a very high pressure, part of pathology. The surgeon will come into your office and he will wait. He will literally stand in front of you, and you are looking at your slide and trying to make a diagnosis, which can be sometimes not intimidating, but sometimes, you just need to think in peace and in calm, but it's more of a like a very rushed situation. Like if you ever rotate and go on a frozen section, you'll see how people are running around, bringing slides, drying it, and all that, all those sort of things. So I think that is one aspect. The other thing is that some people, like if you are in a very busy practice, it can be a very, very busy life for you. So please don't think that pathology is like, very easy. You come and go, and, just because it's not a clinical branch, but still it can be very busy. So I think those are the more challenging things. And then I think one thing which I have seen affect some residents is that forensic pathology. I've seen people like literally faint in front of the dead body. And that is not a good scenario. So, like, you have to be a bit more brave-hearted, in that scenario, because I've seen, like, yeah, very bad reactions to that field.
Yeah. So kind of going off misconceptions and myths, what are some common myths about the GI tract, especially when it comes to diet, nutrition, or eating habits? Because you hear a lot of these different types of diets that people think are more healthy than others, but in reality, it's just hurting your digestive tract.
Yeah. I think like there are a lot of myths out there, I would say, and like, but I think the most common ones that I have heard, because now like people know that if someone comes to know, they will come and ask me, yeah, that, okay, I have fatty liver disease. What do I need to do? How do I need to change my diet and all those kind of things? So I think that, first of all, the biggest misconception I've heard is that carbs, you can't eat carbs. Oh, I cannot eat carbs. No, you can eat everything, but portion control is the key. And then, like some people go on these extreme diets. I would just say that the biggest thing is ask yourself, can you follow this for life? If you cannot follow this for life, I don't think it's worth doing. Like, okay, it will give you temporary, loss of weight, but then what are you going to do? You will get all that back once you go to your routine. So just follow that. So I think one thing is that I think fats, like some people are against fats, they will not eat an egg, or just only eat egg whites. So I think that is one. Again, everything in proportion is fine. And Another thing which is very relatable now is that a lot of people think that, oh, I just drink once a while, and but in that once a while, they will binge drink. So that is really harmful to your body. Like some people don't want to accept it, but I think it's so bad because we get so many, like I cannot even tell you the number of cases we get every day of people having this fatty liver disease, and then they have steatohepatitis, and then I have seen like 18-year-olds with cirrhosis just because they were binge drinking and they did not realize. They were like, we were drinking once in a while, and then you have to be on this long list of liver transplants. People don't get livers, and you will have a really bad life. So please stop doing that. And now if you see researching, if you like just YouTube, even like it's said that even one drop of alcohol can cause like such bad repercussions on your body. So at least like be very mindful of when you're drinking, how much you're drinking, about all that. Because yeah. And the last one that I have to say is that talking in the sense of liver, people have started taking a lot of herbs, just ordering them off Amazon. Like, for example, one of the big one is ashwagandha. So they will take that. They will take like any and random supplements. Oh, I went to Mexico. I took this. I took that. And like, oh my God, these people come with acute liver, like their ALT and AST is in thousands. They are in bad shape. People have gone into hepatic encephalopathy just because they were taking some random drug ordered off Amazon or over the counter drug. And, it just causes, drug induced liver disease, which can be really bad. So please, yeah, one thing I would say that it's a misconception that, okay, this will help me sleep, this will calm me down. But, just be very wary of just taking anything off the counter.
Yeah, that was a lot. I mean, I have a question myself. I know some people are huge fans of the carnivore diet. I never really understood the craze about that or why people do it. But could you explain a little bit more about that?
Yeah, I think diet, like a lot of people have different diets, but I think um I don't know. Honestly, I would say myself that I don't understand the craze about it. But I think the healthiest, I think people in the name of protein, they will eat a more carnivorous diet and they will say, oh, it's protein, but your body needs protein, but it doesn't need so much that it doesn't, because everything that is not required by the body will ultimately be converted into fat, and it will add to the stores which you don't even need that much. So I would think like most of the clinics now, they recommend Mediterranean diet or a plant-based diet. But I think even that, incorporating like like the easiest way to explain to patients is have a very colorful diet, like which includes like of course meat is not colorful. So then you eat a lot of fruits, you eat a lot of vegetables, and I think of course protein is nice, but I don't think it should be so big on that you forget all the veggies and fruits. Yeah.
So on a more personal note, how do you maintain a healthy work-life balance and manage stress outside of medicine, especially when you say that you're on your feet a lot while in your fellowship and you probably will be when you become an attending. So that work-life balance is so important. So
Yeah. So I think I would say, to be very honest, I've been very guilty of not having that balance. Because the fellowships they're hard. Like you have to be at the hospital at 5:36 in the morning, and then I've seen people who literally just went home to sleep. But luckily I have kids. I have two kids, so I had to draw that line somewhere. But I think what I like to do, and like now, the biggest part of being an attending, the good part is that you catch up on time. So you don't have to go to the hospital. Like now I can be there at 9 and that's fine. So I save those 3 hours. So I think, but personally, whenever I've been too stressed, I think I meditate a lot. I think that really helps me. And, just taking walks, lighting a candle. I'm big on candles, so all that helps me a lot.
do you have a favorite scent for your candle?
No, I trust me, I just experiment all the time. Yeah. But
Um,
I would say not a favorite, but one of my favorites is lavender.
Yeah, lavender's a good scent. Quick intermission. If you guys have any questions, feel free to put it in the chat. We are nearing the end of the webinar. And is there anything else you'd like to share, especially with our audience of pre-med undergraduate students and any non-medical advice as well?
So, medical advice, I would just like to say that I don't think people say that this commonly, but please don't be scared to take chances. Like don't think that, oh, everybody's going into, neurology, so I should go into neurology. Everybody is going into OBGYN, so I would go. There was a time in my life when I just wanted to do OBGYN. And I think I also say that the kind of the universe chose me because I met so many OB. I'm not bad mouthing any field, but I'm just saying that there are people who go into these very busy fields and then they become so unhappy. Their lives are so stressful. So see what is good for you. I have seen many microbiologists who are so happy that, like their happiness, you'll be jealous. Like, what are they doing that they're so happy? So ultimately decide for yourself. Please don't run in that rat race and also I would say that if you can, don't be so stressful. Like, some people, like as you were mentioning before, like some people take gap years, some people don't. So do what floats your boat. Don't follow just the trend that, okay, this person is doing this, so I need to do that too. I think that's a lot which I've seen in the rotating med students as well. Yeah, I would just say that experiment early on. You are not getting late. Everybody has their own timeline. So yeah, just do what and if you can do things to relieve the stress, because that has a chronic effect on our bodies.
Well, this is a little unrelated, kind of going off what you just said. How big does stress play a role in like digestive health? Because I know a lot of stress kind of disrupts that whole
Yeah.
cycle of things.
I think it is a huge part. I have seen, like just talking of people, like sharing, when people talk, they share stories. Even I have met a lot of people off work when they tell me that, like some people just stress eat. It's different for different people. Some people stress eat, some people stop eating, and then, some people's hormonal imbalances occur just due to stress. I have seen so many people, so many of my friends have told me they got hypothyroidism after a big, period of stress in their lives. And then it never went away. They just got, and especially I think autoimmune disorders. It's a big thing related to stress. So, yeah, I mean, that's what I'm saying. We are all guilty. We just like, okay, I have to achieve this, I have to achieve this, I have to achieve this. And when you reach there, you have deteriorated your body so much over we have exploited our body so much in that run that we just forget. So, if we can strike that balance, that would be amazing.
100%. So we have a question in the chat. How big is the field of pathology? How many pathologists are in a hospital, and how competitive is the specialty?
So, I would say, I mean, I don't know how to say how big, because you can imagine like how many tests a person has, how many labs we have, how many biopsies. So I think it's a very big field. I would say that it's a backbone of medicine. And, so it is a very big field. And, sorry, what was your second question in
How
the,
many pathologists are in a hospital, and
so it
how
depends
competitive is it?
on It depends on the size of the program. For example, in Cleveland Clinic, just in the gastrointestinal pathology, there were like 25 only GI pathologists. And then there were in every field, like, so basically there is a pathology from head to toe, So there will be a neuropathologist, there will be a cardiovascular pathologist, there will be a pulmonary pathologist, and then GI. Then there are genitourinary specialists. There are gyne pathologists, and and then orthopedic pathology is another branch. So based on the size of the program, a lot of so there are different types of practices. There are hospital based practices, there are just academic practices, and there are private labs. So it just depends on how big the lab is or how big the hospital is. It could be anywhere from like 100 pathologists in a practice. Some may just have like as small as 5 pathologists in a practice. So it just depends on the size.
So we have three more questions, kind of to combine two of them. I know you briefly answered this before, but what does a typical day in pathology look like for you, and what are the typical hours that you work, and do you have to be on call?
Yeah, okay. So I'll tell you what a typical day is for example, as a resident, and then and then I'll tell you as an attending. So as a resident, you go in, for example, you are on anatomic pathology because you rotate on anatomic and clinical pathology. So in anatomic pathology, you go in the morning. Usually, any residency, pathology residency has a lecture in the morning, 8 to 9. Then you sign out with the attending, so you get cases like depending on which rotation you are. You may be on GU, you may be on head and neck, you may be on GI, and you see cases the prior evening, and then you look at them with your attending on a multi-headed scope. So they go through over every slide. They show you what features there are, how we make a diagnosis, and all that. And then after signing out, you have a break for lunch, and then you gross. So all these specimens, that the big uterus, the larynx, the liver, the prostate, all these organs you get, and depending on your specialty, you gross them. Grossing means you grossly examine the organ in front of you. If you open it, you see there is a tumor, and then you take sections, and then you get when you get the slides, then you look at them. So this is what anatomic pathology is. If you are on a clinical branch, then it may look a little bit different. As an attending, it depends on the type of practice you are in. For example, if you are on a hospital based practice, you will come in, you will see some slides. Some pathologists do both. So some hospital-based practices, you also have to take calls. So for example, you are on call and you may get a call for a transfusion medicine. So they will ask you that, okay, this patient had a, transfusion related reaction. How do I manage this? So you have to manage that. You will have other paramedical staff with you who will help you, but you have to manage that. You have to see how the apheresis procedures will work, if the patient is getting concentrated RBCs, like all those kind of things. So you will have transfusion medicine related calls, and you also have to sign out some clinical. Some practices are that you just come in, you sign out your cases, and you go home. So some places are very flexible. They don't care as long as you sign out the number of cases. Um, so you may have a day from from, for example, from 9 to 6, or 9 to 3. It also depends on how efficient you are as a person. I have seen people who stay, even as attendings, they stay till 9 in the hospital, and 10 case sign out cases at 9 at 10 at night. And there are some pathologists, for the same amount of work, they leave sharp at 5 p.m. So it depends on you as a person, where you want to draw that boundary and have that work life balance. And the other thing I would say is that, of course, if you are on call, then it is different. For example, if you are on call, you may get a frozen section um, at 10 in the night, so you have to go in for that, and or you can do it digitally. The other thing that pathologists get called for is, for example, there is a liver, so they have donor liver and donor kidney examinations. So, for example, there is a patient who died in a motorcycle accident, and in in every country, I think you can choose to be a donor if you die. So, for example, this person had chosen. So the donor society will, get that, and they will bring in the patient. They will keep running this perfusion so that the organs are intact, and they will open it, look at the liver. If they think that the liver is healthy looking, they may biopsy it, and then, based on the biopsy findings, they will transplant the liver to a whoever is next on the list. And same for the kidneys. So for that also, the pathologist will be called in, and that can be like at 2 at night, or at 4 in the morning. So yeah, so it
And we
all
have,
depends on which kind of practice you are going into, and you can make an informed decision if you are into pathology.
um, so we have one more question. Were there any specific experiences that helped you decide on pathology?
um I think, like, I told you my story, but I know a lot of people who choose it just for the work-life balance. I just saw that pathologists are very happy. You don't have to work weekends. You can, based on the number of cases, you can have a good working day. And now as I'm saying that, actually, if you see the data, more than 50% of the pathologists in United States are immigrants. So they are all international medical graduates. But now looking at how good of a work-life balance this field has, and how we are paid well, and everything. There are so many pros now that I've seen a lot of American graduates are also moving towards this field. So I think there are a lot of pros. Like, and now with everything going digital, you will have so much flexibility. You can choose your day. You can, sit on a computer screen, and you will also have the option that you can go into work or you can work from home. So I think all that kind of makes it like a really good field to think about. Yeah. Like my husband is a neurologist. I see that, he still has to go in at 6 in the morning. He has minimum 12-hour work days. And, of course, there are pros in their field as well, but it's a very high pressure job, I feel. And I feel like, I don't know, I think we already have a lot of stress now, in today's world. So if we can reduce it at work, there's no harm.
Um, are there any other things that you want to say before we cap off the webinar, or any more questions from the viewers? It doesn't
I
seem
think
like.
I summed up all my thoughts. I'm happy to take any other questions. And if anybody has more questions, I'm happy to share my personal email and cell. And, you feel free to reach out and I would be happy to help you.
Yeah, we can send out your email to anyone that reaches out to us. Um, Actually, we have one more question. Is there a private sector to pathology?
Yes, there are private labs. Even the hospital-based jobs are private, and like and again, you can choose. You can go to a very busy practice. You can go to a practice which is very flexible. They pay a lot of money. Pathology, just because of the volume and everything, they get a lot of bonuses. So I've seen, like, yes, you can go and, like, for example, if you think that, okay, I don't want to teach residents so much. I'm not I just want to go in, sign out my cases in my office and come out. You can go into private. In academia, like, you have to teach residents, you have to do a lot of collaborative work. But again, if you are more of that kind of person, you can go into private practice.
Yep. Dr. Sekhri, we truly appreciate you being here with us this evening and taking the time to share your experience and lessons with our listeners. To everyone who joined us, thank you for being a part of this conversation. If you have any additional questions, like we said, just reach out to us and we can provide her personal email to you guys. And a record of this webinar will be on our YouTube as well as a podcast on Spotify. As always, feel free to reach out to our PhysiLink team with the contacts listed on our website. On that note, thank you again for attending, and we hope you have a wonderful rest of your day.